Namaskar, Vanakkam and pleasant morning to each and every one of you. I'm really thrilled and excited to be a part of this 8th convocation that is happening in this biodiversity-based rich environment, which is Naipur Guwahati, with the august presence of esteemed and distinguished guests on the dais and off the dais, along with PG students, research scholars, the proud parents, well-wishers, and press and media. Friends, today is a very, very great day for me because from morning I have been really listening to nature. I was able to talk to nature, maybe after a long time. In Delhi, it is very difficult. And I could see it's a great darshan to see the great lush green environment and above all, the kind and the clean-hearted Northeast general and domestic public. And this particular institute, I should thoroughly congratulate Murthy Garu. You have brought in lot of new dimensions to this particular institute. Within 8 years of its survival, what are the basic things that could be brought into this institute? I think he has done it in a marvelous manner. He has never left any ministry unattended for the financial support. Starting from DST, DBT, MIT, Ministry of Commerce, IPC, I think everywhere, MOTA, every ministry somehow he was able to get the funding support. And above all, your own DOP has given you the Center of Excellence for Phytopharma. And in my opinion, this institute should definitely add value to the Phytopharma B&D repository of this country. Why am I telling is, when this is a pharmaceutical education research-based institute, you are the experts and you should be the veterans and you should be prioritized to come up with the indigenous as well as I would say Bharatiya Nirdeshak Dravya, we call it as B&D or certified reference materials. When we talk about this Center of Excellence in Phytopharma, I'm really tempted to make it as a kind of an appeal to each and every one of you. We, by sitting in Delhi with the National Physical Laboratory as the institute of, I would say, eminence or Indian Meteorological Institute, IMI, we are now enriching our repository for B&D. Because I'm being told that the country is spending on a minimum scale. I'm talking about the minimum. Lowest minimum is 10,000 crore only to import this kind of certified reference materials, CRMs. When you are completely surrounded by this biodiversity and the mountains and the plants and the trees and the soil and the air and water and the entire ecosystem is close to your heart and it is talking to you and you are able to listen to the nature and you have lot of tribal healers, those who are living here. And therefore, this is one of the greatest arrangement that nature has given you. Nature has abundantly blessed you with this kind of a biodiversity and therefore, who else in the country can make the biodiversity related, phytopharma related repositories rich rather than this Naipur Guwahati. Therefore, please make use of this opportunity. Prioritize your research in such a manner. You will come up with not only the publications and the patents, but also copyrights. Murthy Garu, please ask your people to come up with copyrights. Because now the trend is getting changed. Publications are important, I don't deny. Patents are more important. Because that only will give us the intellectual property related rights to us, IPR. And more than patents, copyrights are also equally important. And when you are going to work and you have been working with respect to medical devices and medical assisted devices, you should come up with the design patents also and copyrights also for your medical devices. I'm sure many of you would have gone through the very recent Nature publication. Just last week just 2 days back I happened to read, where people are coming up with a kind of a medical device even to cure pancreatic cancer. It's a small device and the concept is very, very simple. By way of alternating the electric field, they try to really have a better control over the division of the cancer cells. So if at all one can manage by way of giving alternating electric fields and try to have some kind of a controlling measure with respect to the diversifying or the division of the cancer-affected cells, I think this is one of the greatest examples that you can make it. This is a concept which needs to be explored in a much more different manner. They have now started using it. That kind of an alternating electric field is given to the abdomen of the patient very periodically. And therefore, you can see how they are responding when they are undergoing chemotherapy also. So one institute has already come up with the patient study, that is 571 patients they have already tried. So FDA has given complete approval for this device. And therefore, from India, you should make it as a basic concept. And today morning, I just spread the information to my CSIR family also. And I asked my laboratories, as many laboratories as possible should work together. And in India also, we have to really repurpose this concept to the maximum possible level, that how many possible cancer-related diseases could be brought under control with this kind of a concept. So this is one particular institute wherein I have been told that pharmaco-engineering laboratory is also really functioning with a lot more new dimensions, and I have been listening to one of your professors also. So where you are talking about the kind of a badges or the kind of the strips or the kind of a small devices with a kind of a partial release, on-off release, and a targeted drug delivery, and with this kind of a very regulated delivery systems which could be personalized to the patient, this is a good start that NIPER Guwahati is now coming up with. You are writing the first chapter of your success story. Days are not so far off if you continue to work in the same field by way of using the 3D printing and 4D printing, and if you come up with this kind of a pharmaco-engineering related devices, days are not so far off. You are going to come up with very many success stories with respect to medical devices. And thanks to the Government of India, because under PRIP scheme, all the 7 NIPERs are given one or the other Center of Excellence, and I am given to understand Center of Excellence for medical devices goes to Ahmedabad, and the Center of Excellence on phytopharma is given to this particular NIPER. So now country is having a complete holistic idea, perfect understanding, because now you and me, we need not even break our head, because the national leadership and the scientific leadership and ministries and Niti Aayog, the think tank, everybody is making all of us to just to listen to them, because they have already identified what are the prioritized areas, what are the areas to be prioritized. The moment we listen to the priority list that is being recommended by the Government of India, that is more than sufficient that India will come up with more and more indigenous success stories, which is very, very important. Because this kind of indigenous success stories should be adopted, admitted and implemented in the other countries also in the global arena, and you have to create a history in that way. You may think that the history is very difficult to get created. It is not so. Why? Because already the pandemic, COVID, has given us a great lesson, and that only really introduced to the entire globe who India is and who Indians are. What India should be remembered for. Never before we Indians thought that we have this kind of a potential and capability that we will be able to even manufacture indigenous combination of vaccines, and we'll be able to even export it to as many countries as possible. Was really very hard to believe, hard to think, and hard to even dream about it once upon a time. But COVID made it possible. And even from CSIR, I'm coming from the CSIR family, and your director is also a part of a CSIR family member. We always say, once you are a CSIR family member, you will be always a CSIR family member. He may claim that he is a NIPER family member, but I claim that he is a CSIR family member. Because his laboratory, IICT Hyderabad, they came up with a kind of an argument. Whomsoever in the country has taken Covaxin, so you people have already taken a bit of CSIR in your body. Meaning is CSIR has already reached you. We have touched the life of every Indian citizen to the maximum possible extent by way of that adjuvant. And therefore, these things need not give you any kind of a question mark whether it is possible, because we have already made it one time possible. Just to showcase our potential, showcase our bandwidth, showcase our capability, we should not wait for one more pandemic to come. So because pandemic made us to realize that we have this kind of an inherent potential, and therefore, NIPER Guwahati and other possible NIPERs also, we all should work as a team, because already whether it is CSIR or DBT or ICMR, we are already working very closely and we are working together always. Even in our phytopharma mission, the arrangement is in such a manner that we'll come up with a kind of the identification of the active molecules, and we will do up to preclinical studies. And when it comes to clinical validation, at that point of time, we used to hand it over to ICMR, thanks to the Secretary Rajiv Bahelji. He has already earmarked 10 crore just to do the clinical trials and the validation of the phytopharma active molecules, for which the preclinical study has been done at CSIR. So to that level, we are working very close, and we are willing, we are open-minded. We are so happy to share the responsibility. We are happy to share even the recognition. And therefore, I urge NIPER Guwahati that you have to really make this phytopharma related CRMs as your first and foremost priority. And please get it deposited in the repository of NPL, because it is not CSIR repository, it is the national repository. You all may be knowing National Physical Laboratory is the timekeeper, Indian Standard Time, IST. It is maintained by this National Physical Laboratory. The Constitution of India, the physical copies are also maintained by the National Physical Laboratory. In the same way, we have already taken up the responsibility. We volunteered. On our own, we have taken up that responsibility of maintaining this repository of CRMs. And nicely, we have named it as Bharatiya Nirdeshak Dravya, BND. Like the way you started with 5 students, and now 3 students, and now you are rich with 500 students. We also started with 3 CNDs, BNDs, and now we are rich with 186 within a period of 2 to 3 years. And therefore, if at all of us start working together, and if NIPER Guwahati is also going to enrich our repository, I think we may be able to come up with many more hundreds of samples in our repository. And I take this opportunity to make it as an open call. And I'm being told that you already have a kind of a working arrangement, an MOU in place, and therefore please make it very rich. And second thing, I was so far thinking that Northeast coal is very popular. In India, there are 2 types of coal. So one is I would say Dhanbad side coal. So that coal is rich with ash, whereas this Northeast coal is rich with sulfur. We from CSIR, we have already again volunteered one more very important area. Can we convert the coal into syngas, into methanol, into DME, into sustainable aviation fuel? And we have already crossed several steps. So coal to syngas, we have already found out our technology. Then syngas to methanol, it is in between. Methanol to DME, already it is at the tonnage level we have proven. Then again, sustainable aviation fuel also we have technology. But we have used many times, it is the graphite or the ash-rich coal. But this place is very much rich with sulfur, and today your director made me to understand your water is also rich with iron. And therefore you as a pharmaceutical education research, you can prioritize how best your water quality can also be improved, and how best the iron value could be repurposed. If need, you can remove it, or otherwise you can repurpose it. So what are the best ways by means of which the complete biodiversity of this Gauhati could be utilized in the name of Naipur Gauhati should be the objective. And I'm so very happy because you have the right choice of the leader in place. And he has introduced even gold medals. And I'm thrilled and excited that when he said that all the gold medals he is having sponsors. I think he has grabbed the attention of all the pharma-related companies of Hyderabad, his own place. And he never left the former directors also, that also he got their attention. He never even left the governor of Assam also. So, and he himself is also one of the sponsors of the gold medal. And I think you are a true and an amazing leader because you are leading by setting yourself as an example. So this kind of motivations, this kind of, I would say, guidance, mentorship, encouragement and support, when it is coming at this initial level itself, all of you should really make use of it. I am coming from an institution which is 8 decades old and you are 8 years old. And what a great combination. Within these 8 years, you are able to really live up to the expectations of the 8 decades of this institution. And I'm just giving it as an open call. Please join us in this journey because you also talk about this personalized medicine. I told Murthy Garu today morning, along with the personalized medicine, you have to make it as a preventive and personalized medicine. And I told the other professor also, when you are just making use of your pharmacoengineering for personalized medicine, try to make it as a preventive device also. Because we Indians, we always believe that prevention is better than cure. And we have the strong belief that food itself should be the medicine and it should not be the other way around. Medicine should not be the food. But somehow for lifestyle changes, nowadays we are grabbing and we are taking, trying to digest as many medicines as possible. But if at all you are able to come up with a kind of indigenous phytopharma-based medicines, side effects will be very much under control. And it is completely Indian ecosystem-based. And therefore, response will also be very much. It will be more. And the patients also will have more and more trust and belief. And therefore, please make use of all the positivities. And this DOP, on the other day, I was there in your governing council meeting, which was chaired by Honorable Minister Naddaji. So even the Honorable Minister was able to spare 2.5 hours time to attend and listen to the very important presentations and points made by every director of your NIPER. All the 7 NIPER directors were there. And you can definitely guess, among all the 7 directors, it is your director who has taken more time to explain, more time to make the whole community to understand that what are the different areas in which you are doing a lot of research, which is really globally also important. And he has taken it up to the level of even calibration of equipments, and you are inherently sandwiched between AIIMS as well as IIM. And Murthy Garu is making use of these IIT, AIIMS and IIM, all the presence together. And therefore, please visit all these institutions. Try to make consortia. If AIIMS is close by, because you started your journey from the medical college, now AIIMS is your nearest neighbor. And therefore, for you, even getting the patient or doing any kind of a clinical trial is not going to be a very costly affair. You have the MOTA support also. And with the MOTA support, recently, we also took sickle cell anemia as the very important thing. And for sickle cell anemia, it is the CCMB Hyderabad-based laboratory. They have come up with a kind of one PCR, which is costing less than 100 rupees, 93 to 97 rupees per unit. Whether you are a SCA carrier or not could be understood well within a time of 20 minutes. Once upon a time, you have to wait for 2 to 3 days just to know whether you are a SCA carrier or not. Now, with the drop of dry blood, within 20 minutes, with a PCR, one can very easily understand whether SCA carrier, you are a SCA carrier or not. This is one, but the research doesn't get stopped over there. Once you understand that if you are a carrier, what next? This is where IGAB is coming up with a solution. Today, to cure sickle cell anemia, in Indian rupees, a patient will be requiring a minimum of 30 crores, 30. So 30 crore Indian rupees is required to get the treatment. But we, by making a kind of a CRISPR-Cas9, engineered CRISPR-Cas9 technology, we have come up with a kind of a solution, and we have transferred it to the Serum Institute, Pune. So Serum Institute, Pune and CSIR IGAB, both of us are now working. We are taking the help of AIMS. 3 patients have already registered. We are going to do the human trials now. And we are 100% sure that we will be successful. So once we prove our success, it is not 30 crore which is required for a patient. It is going to be only 1 crore. And with a kind of a, I would say, the positivity that we have in our mind, our next step is going to be how to reduce it from 1 crore to 50 lakh. Why 50 lakh? Prime Minister's insurance, medical insurance can give coverage up to 50 lakh. Therefore, if at all a tribal person is having this SCA as a disease, he or she need not even spend even 1 rupee in future, maybe after 2 years or 3 years, once we prove our success. They need not even pay any penny from their pocket. It will be completely covered under the insurance scheme. Why am I giving this example is, you should also take your efforts to that level of giving end-to-end solution, by means of which, because already you have the tribal healers also, and therefore you attack the disease from the phytopharma angle, and also for your human trials, you make use of the AIMS, who is very much close to you. So putting together all your efforts, I think days are not so far off. Your success is going to be celebrated not only nationally, but also internationally. The kind of, I would say, encouragement and the motivation that is being given by all the very important staff members. And more than the staff members, I wish to give a big salute to the parents, because they understood that this is one great institution that can offer the right choice of education to the son and the daughter of the family, so that they will be able to really address the problems of this community in the coming times. So you are the ambassadors, and you are going to take up the challenges of the country for the healthcare related issues. Nowadays, people are talking about virtual warriors for many, many known, unknown, desirable, undesirable purposes. But I will say, you are the real warriors, healthcare warriors in the real-time applications, and therefore feel proud. Say thanks to your parents. Hearty congratulations to all the people, those who are getting your degrees today. And I'm so very happy the female population is not only equal, it is slightly exceeding the male population here. And therefore, I'm personally feeling so good and very happy. And I'm going with more than enough confidence that days are not so far off. NIPER will come up with a new success story. In the name of NIPER, India will be remembered in the global arena. And I wish all of you all the very best. Thank you very much for the opportunity. Namaskar.